who improved after they went back into society, we know, okay, they're okay. But if they persisted in having problems, especially after going back into society for 1 year, 2
This podcast shares personal stories and professional insights, but it's not a substitute for medical advice or therapy. If you're looking for support, do speak to someone qualified and trained in child development or special needs care. You'll find the full disclaimer on the screen and in the show note.
Hello, welcome back to another episode of Adapting Together, which is a podcast created to normalize conversation around autism and also to raise awareness about autism, to support parents and caregivers emotionally and also maybe a little bit intellectually on the information that you need to know in order to provide better support to your children and your own self as well. So if you have not listened to the previous episode, which is we have a guest, Dr. Rajini, who share with us more about autism and what should you do as a parent before you get an appointment and many other things. Do listen to that. This is a part 2. It's a continuation to the first episode. And just let's continue. Thank you, Doctor.
Yes. So, hi, doctor. Hi again.
Hi. Hi.
Yeah. So, let's go into this question where I think a lot of parents they will say, "Oh, Carmen, is it my child just delay, or just speech delay or just movement delay, they will use term like delay, in order to accept the ASD. Yeah. So maybe you can share a little bit about this definition, or the diagnosis. Yes.
Yeah. So I think it's important to understand that when we talk about delay, what we're trying to say is there is a chance for the child to catch up on their milestones, right?
Yes.
And when we talk about autism, if you look at the definition, it's a social communication impairment. When we talk about impairment, what we're trying to say is this child will have difficulties in that area, right? And this is going to be lifelong.
Yes.
Yeah. Okay. Now, it doesn't mean this child is not going to be able to function, but with difficulty is what we're trying to say. That this is not just a delay that they're going to catch up and everything's going to be normal, right? So that's the difference. Yeah. And sometimes it can be misleading because, there is a term, there are kids who have speech delay and there are kids who have motor delay. But in those children, what we're anticipating is that they're going to catch up. Medical definitions are very confusing and sometimes doctors themselves use it incorrectly. So then that also then influences how parents understand it and expect it. But I think there's also the fact that in social media especially, you hear of parents posting that they've cured their child and things like that. So then it's very normal for us to then hope that our child's just delayed and we use that term, right? So I think understanding the difference is important. Now, it doesn't mean that every time a parent comes in to see me, I'm going to say, no, it's not just delay. I say, yes, delay, but she hasn't quite caught up and the gap is getting longer. So that's me trying to tell the parent, this is no longer a delay. It's going to be harder and harder for her to catch up, but let's work within what she's able to do to see whether that can help her to function in whatever environment she's in. In medical terminology, there's something else that is misleading, is global developmental delay. And I hate that, but it is a definition. What do we mean by that? Because again, it's delay, right? Because we know that most children with global developmental delay end up having some difficulties in learning later. Okay. And all it means when we are saying global developmental delay is they are delayed in 2 or more areas of their development.
The first time I heard GDD is the right. I read global developmental delay. So I was thinking to myself, I'm in Malaysia, what is this global? So for me, it's like global, It's very confusing, just like what you say.
Yeah. But like I said to you, we talk about gross motor, fine motor, language and communication, self-help, and interactive social skills. It means that two of those areas are delayed, two or more of those areas are delayed, then we say it's global. Yeah. Because we cannot say fine motor, gross motor, speech. It's too long. So we say global developmental delay.
Yeah. Okay. So I think now we always commonly, even my son that's 17 years old, easily can hear friends say, hey, ASD, ADHD, GDD,
Yes.
all this term. It's also like quite commonly they will use it or they heard it, among their community in the classroom, in the school setting.
Yes.
I think there is the rise of number, kids on the spectrum. What is your thoughts about this?
Yeah. I think it's not just a rise of number of children on the spectrum, but it's actually a rise in number of children with developmental problems.
Okay.
And this overlaps with the rise in number of children with learning problems and also mental health problems. It's all the brain, right?
Yeah.
Okay. So what do I think about it? Yes, I think in Malaysia, a lot of it's to do with increased awareness. I think that's why we're seeing a rapid rise. Yeah. Awareness, number one. I think if we look at our population, diabetes is a big problem. And diabetes in pregnancy has increased exponentially in Malaysia. And that affects a baby's development in the womb itself.
Okay.
We are also seeing that maternal nutrition is a problem.
Okay.
Sounds funny because we seem to be a more affluent society.
Correct.
But remember that nutrition is not about the size you are, but what you put in your body. So although people may seem to be, the appropriate weight and height, but they may not be taking the micronutrients in fruits and vegetables because of their diet, because of their lifestyle. Maternal stress, maternal and paternal age. So the age of mothers and fathers when they have babies is also increasing. So all these things contribute to the increase in the prevalence of developmental disorders, especially ASD.
Okay.
I think awareness is a big factor because
Yes.
we don't know what we don't know, and if we know more about certain thing, and
Yes.
people will start to suspect that, I think I check off some of it,
Yeah.
and that could actually prompt this person to go and seek out diagnosis.
Exactly. And I think we are also seeing an increase in adult or young adult diagnosis of a lot of these conditions, ADHD, autism, dyslexia, things like that.
Yes. And I noticed that after pandemic, seriously, as a consultant, whenever we meet parents, for them it's quite hard for them to accept the child on the spectrum because they have so many. They will say that it's due to pandemic. They have all the screen time. Stay at home too long. Never see the sun. So yes, doctor, maybe you can also share from your perspective. Yeah, what do you think?
I think the pandemic, was a very, it showed us how important the environment is for children to develop. I think we all underestimated that, and then the pandemic has shown us that. Does screen time cause autism? The answer is no. Okay, it's not a cause and effect. However, when a child is having excessive screen time and it's not balanced with nurturing human interaction, yes, that is damaging. Yeah. And what happened in the pandemic is these children were stuck at home. They were stuck at home because we were all locked down, and Malaysia had one of the longest lockdowns, number one. Number two, not only were they locked in their homes, parents, even when things started to open up, parents were scared to go out. Okay, all right. And so the children were stuck at home even longer than when we were all allowed to go out. They were not going out, right? Parents were scared. And then people were wearing masks for longer. They were not seeing people's facial expressions. People were not mixing together. Families who previously would get together were staying back because they're scared might infect somebody, my child might pick up something. So if you think about the environment many of the children were growing up in, it was a bubble. Even those children who did not have excessive screen time where the parents were trying to engage with them and whatever, they still suffered from the lack of social interaction, right? And the lack of stimulation from being outside. And remember, if we talk about environment, we talk about human interaction, we talk about exploring different senses,
Correct.
the grass, the pebbles, the road, the sound of cars, sand, the sound of water, the sound of birds, things like that. And then there's sunlight and vitamin D. And one of the things we're finding is a lot more children are vitamin D deficient. People only think vitamin D is important for bones and growing, but vitamin D is also important for your brains. It's also important for your immunity. Yeah. So if you take all this combined, it's not just the screen time, it's everything. Yeah. The environment change, and those children who were already vulnerable because maybe they didn't have the right genes, or they had the genes that predisposed them to autism or any other delay, the environment didn't help it.
Yeah.
It didn't help to protect them. The environment probably allowed the genes to be expressed more. Yeah. So yeah.
Okay. Yeah. Which is true. That's actually my biggest challenge, I think, for the past few years. When you're trying to explain to parents.
Yeah. And I think telling parents, yes, it's good you think about screen time, so please don't give it now. Okay, minimize it. But one thing for them to know is those children who not everybody became autistic, right?
Yeah.
Yes, the numbers increased, but not everybody became autistic.
Yes, correct.
The ones who improved after they went back into society, we know, okay, they're okay. But if they persisted in having problems, especially after going back into society for 1 year, 2 years, they're not catching up.
This is a major big flag.
Yes.
Big flag.
Yes. That tells you your child has a problem.
Yes,
Yeah.
correct. Doctor, any advice for how many hours of screen time a child should have?
My passion to talk about this.
We have enough time.
The recommendation is no screen time under 2 years, except for video calling. But I know it is not possible. If we look at 2 years to 5 years, it is 1 hour, maximum 2 hours of screen time, and that includes educational screen time. And if you look at above 5 years old, it is the recommendation is 2, maximum at weekends, maybe 4 hours, including educational. However, it is also about the quality of the screen time and how much continuous screen time that you are exposing your child to. So what I say to parents is, okay, use your screen time as a way of communication. So maybe if you're watching some nursery rhymes with your toddler, and you're dancing while you're doing it, or you're talking to them while they're watching a cartoon, hey, look, he's jumping and all that, that's fine. But if you just use it as a babysitter, where it's only the screen and the child, then you're actually preventing that child from having two-way communication.
Yes.
Use it tactfully.
Yes. And also look at what your children are watching.
Yes. And just share a bit from my experience is like instead of using a handphone, I still prefer the screen time to be on TV.
Yes. And that's also the recommendation that a bigger screen may be better.
Yeah. And also the best is actually not to allow them to have control over the screen time. If they like to always go back to the same same part, same song, so that part I think is something that we can look into.
The first professional to see my son was a speech therapist. So one of the questions she asked was how many hours of speech therapy. So I still remember, I think the numbers we told her was either 6 or 7. Her face was very obvious, like something's wrong. Okay. But
Yeah.
the thing is, we wouldn't know, you see, because like my son, he was so excited looking at certain cartoon.
Yeah.
So we thought, oh, you are so happy watching it, so we play back for him. He's so more happy, so we just
Play back.
But looking back, how important to know all these things. But
Yes.
again, we don't know what we don't know.
I think this is the part of the dangers of progress in life, right? In my day, when I was bringing up my children, the TV was so easy to turn on and just leave your child there while you go to cook,
Yes.
right? Okay. But of course, knowing the knowledge, then I would pull back, and have the child in the kitchen with me, throwing around some potatoes and onions and banging on pots and pans rather than watching that.
It's a lot beneficial for the child.
Yeah.
The easy way out.
Yeah. But but I didn't have phones then. Yeah, they didn't exist. Or tablets. Who knows? I may myself have used that to distract my child when they were in the restaurant or something like that.
Yes.
Correct.
But we had to think of other ways of trying to distract them.
Okay. On average, how long do you think parents take, to accept their child diagnosis, and why is parental acceptance is important for them?
Okay. It's so wide, that range. I've had parents who have suspected it even before their children were less than a year. And when they come, they see me when their child is 18 months or 2 years, they are already asking me, so do you think he has autism? I'm here because I want to know whether he has autism or not. And some of those parents, they are ready to accept it almost immediately. I still remember a parent whom, and I still do keep in touch with them, and the child was 19 months old. And they came to me, and I was going through, and I was talking to them and going through the chat with them, and I was trying to be tactful. And then the father just said, Dr. Rajini, we are here because we want a yes or no answer, because we want to go all out. We are ready, we have read, we just want to know which is the right intervention to start with our child. I have to say, I've never had such direct parents as that.
It's 19 months only.
Yeah. But they had done their reading, and they had even seen a speech therapist at 12 months. They were given some pointers of trying to engage with the child, but the therapist said he's not ready to come to me, but I will do some parent coaching, that sort of thing. So what I'm saying is there are some who are already ready. Yeah.
Yes.
There are some, I know of a dad, and the son is 14 years old, and he still will not accept that his son has an autism diagnosis. And although the boy at the age of 9 years old, sitting exactly where you are, asked me, do I have autism?
The boy himself asked.
And the father and the mother were in the room, and the father immediately jumped out and said, what nonsense are you talking? Yeah. Okay. And but I worked with the mom, and we did disclose the diagnosis to the boy, and he had heard about it because he goes to a school where somebody in his class had a shadow kid next to him. Yeah. Okay. So what I'm saying is, I still have parents who don't accept it.
But it's pretty crucial, parents' acceptance, because the support and resources comes from parents.
Very much so. So I don't, sometimes I say to parents, you may not like the term, you may not, so like that father who till this day will not accept it, he still comes and brings his son and will give the intervention that's necessary, but he just won't say it.
Yeah.
Yeah. And he won't talk to his son about it. So my worry for that father who, although I think he's partially accepted it because he is still in agreement to do all these interventions that I suggested, my worry is his relationship with his son. Yeah.
Okay. Yeah. So I noticed that when parents, when they accept, that's where they will easily move on,
Yes.
easier to accept for intervention, what need to be done. If not, everything will become so heavy for them. Don't know what to
So that the one doctor say, even though the father has not accepted that diagnosis, but his actions actually very supportive and important to support the child to learn. But the opposite of non-acceptance is denial. I think that one is even more
That is
dangerous.
different.
Yeah.
Yes. Denial is when you really do damage, I feel. And especially when you deny and you don't take any action.
Correct.
Yeah. And you just throw your child into the preschools or the schools and expect your child to just pick up on everybody else around your child to nurture that child.
Yes.
You will actually do more damage to that child.
And normally parents like that, they won't come back to see you, I believe.
No. Or, I correct you, they come back when there's trouble.
Correct. Like maybe when they are close to 7 years old, when the preschool is no longer take them anymore.
Yeah. So I always say the start of the school year, especially the second and third months of the school year, that's when you get a lot of parents calling up to come back again. Yeah. And also because that's when the children are thrown into a new environment and there are challenges.
Yeah.
And this is also why we do this project to normalize the conversation around autism.
Yes.
Because you can try not to accept, but denial actually do more harm.
Yes.
Okay. In recent years, we noticed that there's many centers. You can and many centers have opened in Klang Valley, and which is great for parents. For even I have a center, I also feel good because sometimes my center we don't have enough slot. We also have little waiting list. So in that we can actually refer to other center. But so what do you think? So are there any areas in Malaysia where you think more support is needed? Yeah.
Definitely, I think in the we talk about outside the Klang Valley, apart from the big cities, what I call towns. Yeah, even if you take a state like Selangor, yeah. Now that there are new communities further out, yeah, we're talking about Sabak Bernam, places like that, right? Where there are lots of young families living there because people find it expensive to live in the cities or they're able to work remotely, etc. For those parents to travel out, like to come to the nearest center, is like takes them more than an hour. And I think it's those sort of places where there are new young families with increasing number of young children in that population. I think those are being underserved. And of course, let's talk about East Coast, East Malaysia. There are also in the main cities, yes, maybe centers are evolving.
Kuching,
Yeah.
KK.
But then if we look at the smaller towns and cities and the more rural areas, that's where we're struggling. And I think the other thing is also the cost of therapy. Yeah. Because I know it's not cheap. And especially now, if we're talking about getting well-trained therapists, qualified therapists, you're going to have to pay them more than the minimum wage. So that means the cost is then transferred to parents. So this is where I feel more subsidies from state governments, for those who cannot afford it, I think would be good. I think, the Selangor state government has taken some good proactive actions in trying to help some of these communities.
Under ANIS, right? ANIS program. Yeah.
And I think same with the Sarawak state government providing more state-funded centers, etc. Maybe other states need to look at that as well.
It's actually really true beyond just financial consideration. I think energy and time, schedule arrangement is a big hurdle.
Yes.
You may have money to pay, but your time doesn't allow you to do that. It's also a big problem as well.
And also remembering that young children to travel for an hour and a half, by the time they reach their destination, they're exhausted.
Yes.
Yes, correct.
Yeah. So in a way, we have to also find ways of, and that's why I believe also in parent training, especially for the younger kids, because sometimes intervention can take place in the home if parents are well trained. So you talked about lots of new centers. Yes, we have lots of new centers, but we don't have enough experienced therapists doing parents training. And that does come with experience.
Yes, correct. Because when we experience, then we only can think in advance, what the parents going to face, what are the challenges that they going to face when they work with the child at home.
Yes.
Yeah. So in center, it's very much the environment is under our control. But then at home base, then it's different set of skill that they need.
Would parents-led community be a good way to support these, like parents who have experience, maybe their children are more grown up already, they can share from their experience and can learn from one another?
Yes, very much so, especially in terms of ideas that they use within their home. Remembering that, every child is different, every child's needs are different, but sharing ideas gives you a chance to think about, maybe I can do it in my home, but tweak it a little bit. And that's what we want to encourage more and more of, And I think it's good that a lot, in months like April, you see a lot of sharing
activities.
Yeah, and there's a lot more sharing of lived experiences, which I think is great because that's really the people you want to learn from sometimes.
Yes. But our podcast will not be just in April. We will go through past April also.
Excellent. Because I think there's so much in April. It's overwhelming.
Yes, parents might not be able to catch up so many things that
And I think sometimes it's also just for marketing purpose. You see ASD related contents, but you need it to survive beyond April.
Yes.
Yes, correct. All right. How important is seeking therapy or learning plans that are evidence-based to the child's future prospect and safety or development? Yeah.
That goes with any intervention. I think evidence helps us to ensure that what we're doing is right and not damaging. Yeah. I think the evidence is always evolving. Yeah. Okay. And even in terms of interventions, if in the past people talk about one-on-one interventions being very important, then people talk about the fact that doing interventions in their naturalistic environment is more important. Then people talked about getting the parents to do the intervention is important. And we have evidence for all that now, right? And I think that is so important rather than a lot of hocus pocus interventions that I say are being thrown about. Yeah. Because and I think it's very important for parents to also understand what we mean by evidence. Some people say, "Oh, yes, I've got the paper that shows that, lots of children were cured or 100% improvement in their reading or things like that." I think we have to take that with a pinch of salt and really look at that. But yes, for me, evidence is very, very important. So we know we're not doing harm to children.
Yes, correct. Yeah. One last question for our episode. Yeah, it's actually we have audience from our first episode saying that want to know more information about the OKU card, whether they should apply for it and if yes, how old is the best, and maybe you can hear from Dr. West. Yeah.
Okay. So OKU registration, every Malaysian child with a disability, whether it's mild, moderate, or severe, is entitled to the OKU card, which grants them some benefits. Okay. There's a lot of anxiety about it because a lot of parents are worried about the stigma. Does that mean they cannot go to a normal school? Number two, they are worried that it deprives their children of buying insurance. Yeah, that seems to be the biggest problem now. Number three, will it disable them when they are adults? Yeah. So firstly, how do you get the card? It The card, depending on the disability, so if we're talking about autism, ADHD, intellectual disability, GDD, dyslexia, etc., it comes under learning disabilities.
Okay.
And then there's a category for vision problems, physical problems, hearing problems. So generally, the people who can fill up the cards are medical doctors. Okay. And for example, pediatricians or family medicine specialists for children under 18, psychiatrists. So if it's a vision problem, and eye doctor, ophthalmologist can do it. If it's a hearing problem, the ENT doctor can do it. So if you're not clear, you can also look on the Jabatan Kebajikan Masyarakat website. It tells you who can fill up whatever disability.
Okay.
So for the purposes of autism, it's a family medicine specialist or a pediatrician, either private or government. The second thing is what's the benefits? Check on their website because it changes. But for parents who pay tax, you have an extra child allowance. Even if you don't get the OKU card, the government has introduced this thing that you can claim for up to 4,000 ringgit, I think, in terms of therapy. Yeah. So you can still claim without the OKU card. It is your right to apply for the card for your child. Does it stop you from getting insurance? No, because if your child has a diagnosis and your insurance company knows that your child has a diagnosis, even without having the card, getting an insurance will be difficult. Okay, regardless of whether you have a card or not.
Reflect in the medical history.
Yes, because it's in the medical history. But I think people are trying to advocate that that shouldn't be the case. Hopefully, small gains are being made now. Yes. Number two, does it mean you can't go to a normal school? No, that's not true. There was a bit of a scare that some parents were telling us that, oh, when I put in that my child has an OKU card, automatically the choices for special classes came up. You can still apply for the normal class. Okay? It doesn't mean just because you have a card, you can apply for the normal class. Does it affect your child in the longer term? If your bank knows that your child has got ADHD or autism, regardless of whether they have an OKU card, again, they can say your child cannot open their own independent account. They cannot open an account like a children's account where you are the joint account holder as an adult, so a trusted adult or a trustee account. But anybody who has an OKU card apparently cannot open their own bank account. Now, this is a protection mechanism, and especially nowadays with scammers and all that, I guess it is protection. Yeah.
And also to enter contract, you have to be of sound mind and whatnot.
Yes. Yeah. Okay. I guess that would be the downside. So for those children who are on the milder end of the spectrum, they're able to go through the education system, able to go through to tertiary education. If the bank finds out they have an OKU card, they may not be able to do that. However, I think nowadays you can open online accounts without declaring it. So, there are loopholes, right? Yeah. So you can ask for the card to be revoked, but it has to be signed off by a medical practitioner.
Okay.
But if the medical practitioner feels that you still have the diagnosis and it's still impacting your life, that medical practitioner may not be in agreement to sign to say your child has outgrown the disorder also. Yeah.
Okay. If I may, I just add on again on what doctors have shared. I think the more important or pertinent question is what would be the benefit of having the card for the child?
Some people look at it as a protection. Like, say, if something happens, you happen to be out in the community and your child does something that is deemed to be inappropriate. Having that OKU card may help you explain to other parents. However, it should not be an excuse. We can still train our children to have appropriate behaviors, right? The benefit would be if you get discounts into Kidsania and those sort of things. And of course, if your child wants to attend the government special classes, the class integrasi, you do need to have the card.
It's a must-have.
It's a must-have now. Okay, so that would be the benefits, I would say. Yeah.
So I mean, I can worry about the insurance or not able to open bank account. But if let's say the child's condition warrant this need, then even without a card, I can have a bank account. But the child cannot operate the accounts by himself or herself. Is going to be subjected to be taken advantage by people.
Exactly.
So it's very true. It's for protection purpose.
Yeah.
We can have the worries, but we have to think about what is this thing meant for the child.
Yes.
Yeah. I think it's easier to arrive at a decision that way.
Yeah.
Speaking as a parent.
Yeah.
Yes, which is very important.
Yeah.
Very much.
Yeah.
Yeah. I think don't look at it as a stigma.
Yes.
And there's a lot more opportunities now for people who have the card actually in terms of pushing for inclusivity in the job space, etc. Okay.
Thank you for the add-on.
Any other question that you have?
No more, but is it okay to ask doctor some questions that make you less doctor but more a bit human? Because people think of doctor as
Yeah,
sure. So before we wrap up this one, if I may, maybe doctor, you would like to share with us what do you do at your personal time?
What do I do at my personal time? I enjoy watching Netflix.
Korean or
Yeah. I like dancing. I used to do Bollywood dancing at the place where my children used to learn dancing as well. And I used to take part in annual shows that the school used to have. I don't do it anymore, but I dance, do Bollywood aerobic type dancing. What else do I enjoy? I enjoy going on holidays. I enjoy spending time with my friends and just family time.
And I suppose you also have a lot of satisfaction from your work for the last many years with children. We can see if you are able to see the room, there's many cards drawing from kids.
Yes.
Yeah.
All the drawings over here, bar the one up here, has been done by people with special abilities, I call it. Yeah.
Yes. So with the right support, with the right mindset, the kids, the children, they can catch up. It's just about how we do and what kind of support we provide for them.
Yes.
Any last advice or words you want to add on, doctor?
I think if you are a parent of a child on the spectrum, it's important to know that you're not alone and link up with other families, because I think family support is very important. And family is not necessarily a blood relative. It's people who have like-minded thoughts and understand each other. And remember that when you have family support, your children also gain from knowing other people as well.
yes. So don't isolate.
Don't isolate yourself.
Yeah.
Unless we isolate ourselves, otherwise you can actually always find people who support you emotionally.
Exactly.
And anything you want to add on, Kami?
No, I think that's all.
Thank you very much for your time.
Thank you for allowing me to share.
Okay. Bye, everybody.